Hello, everyone. Today, I welcome Dr. Jeffrey Dach onto the podcast, and I'm so excited to have this conversation, Dr. Dach. Must give a shout out to our mutual friend, Carol Peterson, who connected us. And I know this, as always, I would hope every topic I discuss is interesting, but this is a topic that everybody has questions on and everybody wants to know about. So we're going to get into some aspects of thyroid and thyroid therapy. But for people who don't know you, Dr. Dash is a physician and longtime advocate and also a lucky duck. He lives in Miami while the rest of us are freezing up north. So he's a
Yes.
longtime advocate of natural thyroid, which many of us would call also desiccated thyroid, and bioidentical hormone therapy. He spent 25 years as a board certified diagnostic and interventional radiologist before retiring from hospital practice and then solely focusing on the whole hormone thing. He's also author of this amazing educational book that I use as part of my tools. And also, I had shown you this monster of a book that has like 600 pages in it, bioidentical hormones, and there's a second edition now. But Dr. Dash, welcome to the podcast.
Thank you so much, Jermaine. Thank you for that beautiful introduction. And of course, Carol Peterson is really amazing, and I'm also thankful to her for everything she does. Um, and the everybody people usually ask me, well, how did you get into doing thyroid in your little office? Well, after I retired from radiology, I had eye trouble.
Mm,
I went to a lot of meetings, and the big topic around that time, which was around 2002, 2001, was hormone replacement, which was very big. Of course, uh, that changed very quickly after the 2002 Women's Health Initiative study was published, uh, and the use of hormone replacement declined precipitously because that study showed increased risk for breast cancer in the Premarin and synthetic progestin, which is called medroxyprogesterone.
mm,
The hormone treated group had just a slight increase in risk in breast cancer. So I started out doing hormone replacement, thinking, this is fairly straightforward, and we started a little outpatient office in South Florida here, and started doing that. And then I call myself a reluctant thyroidologist
mhm,
because initially I thought, I'll let the primary care or perhaps the endocrinologist do the thyroid prescribing. That way, things keep things simple. Uh, and Thyroid at the time seemed a little complicated, and so uh, we were letting the other doctors do the thyroid. And then what happened was, over time, I discovered my patients were being mistreated, undertreated, uh, and I realized that if I wanted to do the thyroid medication to be prescribed properly, I had to do it myself. So I I then became a what I call a reluctant thyroidologist. So we've been doing the thyroid, um, primarily natural thyroid, natural desiccated thyroid. And after 20 years or so of doing that, I had enough material from writing about thyroid in my monthly newsletter to put all the material together into this book.
mhm.
Uh, and the funny thing about writing books is they have a they very quickly have a life of their own, and it really forces the writer or the author to research the medical literature and learn a whole lot of extra stuff that uh, would not would not have ordinarily otherwise learned. So I did learn. I learned a tremendous amount, and it's all in the book. I think it's a good book. Of course, I'm a little bit biased about it
Obviously.
since I'm the author.
Mm,
But yeah, we earlier we talked a little bit about David Brownstein as being a good friend and colleague, and he's actually one of my mentors who got me started in some of the thyroid things, and especially iodine. David Brownstein is one of the few iodine experts in the country.
Hmm.
He worked on the iodine project with Dr. Abraham, who was the founder of Iodorol. That was his company. He passed away about 10 years ago, and you can still get Iodorol over the counter. It's made by a different company now.
Hmm.
Um, and so David Brownstein wrote the introduction to the thyroid book.
Hmm.
But I was very grateful to him for that. And one of the things he said in the introduction was that he is when after he graduated from medical school, he read a book on thyroid by Broda Barnes,
Hmm.
and and then he realized, you know what, his dad, who had a heart attack at a young age, around the age of 40, and had heart trouble, angina, and chest pain from
Hmm.
coronary artery disease for many years, was described in Broda Barnes' book in the section on heart disease uh, as a low thyroid condition. And so when Dr. Bronstein saw that, he immediately started his dad on natural desiccated thyroid, and his dad's chest pain went away fairly promptly after starting thyroid, and all of his cardiometabolic parameters normalized, and he did fine after that. He had a thyroid problem the whole time, and so there are a couple of chapters devoted to the connection between thyroid and coronary artery disease in the book. The big question that we get a lot is, well, why is it that mainstream endocrinology and primary care doctors, why is it that they do not prescribe natural desiccated thyroid? And why is it that integrative physicians like myself will preferentially prescribe natural desiccated thyroid? What's the deal with that?
It's
And
like pulling a tooth up here in Canada, trying to get some natural desiccated thyroid.
yeah, the and it's also the same here in the U.S. The primary care and the endocrinologists will preferentially use uh, T4 monotherapy, which is called levothyroxine, uh, which is T4 only. The benefit, one of the benefits of natural desiccated thyroid is this combination T3 and T4. So what does that mean, T3 and T4? Well, thyroid hormone has two tyrosine rings uh, that connect together, and on each tyrosine ring, there's two positions for an iodine.
Hmm.
So if all four positions have iodine attached, it's T4. If one of the iodine is pulled off, then it's T3.
Hmm.
The active form of the hormone is T3.
Hmm.
So there's an enzyme, intracellular enzyme, uh, which its job it's called a deiodinase, which in medical terminology means it pulls one of the iodines off of
Hmm.
T4 to make T3. So the deiodinase is the intracellular controller for thyroid function,
Hmm.
and converts T4 to T3, which is the active form of the hormone. Some people are not good converters. Some people have trouble. Their deiodinase maybe has a genetic abnormality. It's not working well, and they need that combination therapy. They need the addition of T3 to the T4.
Hmm.
It's called combination T3 T4 in order to feel back to normal. So those people who are poor converters uh, don't do well. They don't on levothyroxine, which is T4 only. So those are the people that I usually see in my office. It's about 20% of people on levothyroxine are not uh, doing well with it. They still have lingering symptoms of a low thyroid condition, and these patients will do much better on a natural desiccated thyroid combination T3, T4. You can also, a lot of the new, the new newly minted endocrinologists that are interested in combination therapy, and because they're not allowed to use natural desiccated thyroid, they will use combination of levothyroxine with commercially available T3, which is called Cytomel.
Hmm.
Uh, the chemical name for it is liothyronine, kind of a long
Hmm.
circuitous name, but it's easier to say Cytomel.
Hmm.
And
Or
the
T3, just T3.
T3, yeah, just T3. So you know, the there are you can they're not easy to find, but there are some, especially the younger ones, some younger endocrinologists using combination T3 and T4 in that format, which is
Why would these new practitioners not, you said they're not allowed prescribed desiccated. Why?
well, the drug industry controls the narrative, and the they go to the meetings, and they have uh, they're very sensitive to uh, doing the same thing everybody else is doing. That's sort of that's a form of protection. They're protected if they do this quote standard of care. The standard of care is T4 only, and so you look in the medical literature and the periodicals, even the American Thyroid Association guidelines uh, uh, says that T4 levothyroxine is preferred over natural desiccated thyroid. Back in 2012, the American Thyroid Association guidelines said never use natural desiccated thyroid, and so that was a problem because if a doctor wanted to prescribe it, they're going against the guidelines, which could mean trouble with
Mm.
with the medical board. Uh, that was changed a couple of years later, mostly because of
Mm.
Antonio Bianco, who is an MD PhD at the time at Rush Medical Center, endocrinologist, doing research, mostly with mice, thyroid research in mice, and he showed that he elucidated the entire deiodinase system, and his studies showed that combination therapy with T3 and T4 was far superior to
Mm.
T4 monotherapy, T4 only therapy. And at the same time, he was the president of the American Thyroid Association, and he was on the board for many years. So I would suspect that's why they changed the guidelines and made it a little bit softer that doctors can use natural desiccated thyroid, but T4 is monotherapy is preferred. So that that's mainstream medicine is really controlled by the drug industry, as you know, and so that's where that. Uh, Although if you look in the medical literature, a number of studies, for example, the one done at Walter Reed by Dr. Hong, he showed that patients actually feel better and prefer natural desiccated thyroid.
Mm.
And so there are a number of those studies, which we talk about in the book. The So the other
We
question I
seem
get
to
is,
have, I was just going to say, we seem to have as much of a challenge, not to veer too far off the topic, with desiccated thyroid as we do progesterone here in Canada
yeah,
for sure.
yeah,
And up here, um, the T4 is more commonly referred to, yeah, we still say levothyroxine, but it's more commonly referred to as Synthroid. And
yes,
in my experience, in my practice, and obviously I really only work with people that have issues or need help. So
yeah.
I see a lot of conversion issues. What I commonly see is someone will be started on a really low dose of Synthroid or levothyroxine, and immediately they might get a little boost in energy, which tells me they are converting something, but the rest of the symptoms will still linger. They'll still have the cold hands, feet, their skin will be very dry. I have several clients that have, as Broda Barnes mentions in his book, the fish scale skin, and I even see that
Hmm.
on kids nowadays. And then, of
Hmm.
course, the hair loss. But a lot of, I would, and I'd love your input on this, apart from the deiodinase enzyme aspect, I would argue that a lot of the conversion issues are also due to um, inflammation. Most people have massive systemic inflammation and then liver issues, whether or not that's stagnation, detoxification issues, fatty liver, even cirrhosis. Like those would be the top things that I'm addressing first, as well as nutrition to help with optimizing conversion, especially if the doctor's reluctant to either increase the dose or add in T3 or something.
Uh, yeah, the probably the uh, the main intervention that we use the most to help with conversion is uh, the patients that who are have low selenium levels,
Mhm.
because the deiodinase is a selenium containing protein, and selenium deficiency, patients, the body doesn't have enough selenium to power to make enough of the deiodinase enzymes, and give them selenium. We test everyone for selenium level. Uh, we use a cutoff of 135 micrograms per deciliter, which we don't use the lab range for that. They use the 135 based on a study by Joachim Blaise from 2008. He was an epidemiologist at Johns Hopkins who studied selenium. He came up with the cutoff of 135. So below 135, we give 200 to 400 micrograms a day of selenium, and with the number of studies in the endocrinology literature show that selenium supplement in that dosage range will, over time, you'll see the autoimmune thyroid antibodies decline. The Hashimoto's antibodies are being the TPO and the thyroglobulin antibodies. They will decline over time just with selenium alone. The other major intervention that will help to bring the antibodies down in autoimmune thyroid disease is TSH suppression with thyroid medication. And that can be done with either T4 or natural desiccated thyroid combination T3, T4. We prefer, in my office, we prefer the combination therapy. By bringing down the TSH, that reduces the inflammation in the thyroid glands, and it calms it slows down and calms down the autoimmune disease process. And that's been demonstrated in a number of studies,
I
which we,
just to stop you there, Dr. Dash, I
yeah.
believe it was Carol I heard say, maybe in one of her conversations, that, and most people wouldn't know this, that TSH can be a marker of inflammation, and you kind of mentioned it there. So is that correct?
Yeah, especially within the thyroid itself, because TSH stimulates not only thyroid growth and proliferation, enlargement of the thyroid, and will stimulate the production of thyroid hormone by increasing uptake of iodine, but it also um, increases the production of hydrogen peroxide, H2O2, which is a common cleaning agent available over the counter, is used in the thyroid gland to organify iodine. What does that mean, organify iodine? It means the hydrogen peroxide is used by the TPO enzyme to combine the iodine, which is converted to iodide. I'm sorry, iodide is converted to molecular iodine by the TPO enzyme using hydrogen peroxides, and then the molecular iodine will then attach to the thyroid globulin backbone to make thyroid hormone. So the uh, uh, the the iodine is very important for overall thyroid function. Um, the organification, is sort of the key to thyroid pathophysiology.
Mhm.
Um, and the what happens is the most of the thyroid pathologies that we see are related to either excess hydrogen peroxide generation.
Mhm.
The hydrogen peroxide is damaging. It's highly oxidative. And if there's an excess of hydrogen peroxide generation due to high TSH, the that will damage the thyrocytes and cause thyroiditis, or it can also damage the proteins in the vicinity of the hydrogen peroxide are the TPO uh, enzyme and the thyroglobulin. So that's one of the theories of the origin of autoimmune thyroid disease is the hydrogen peroxide damages the TPO protein and the thyroglobulin protein, makes it antigenic. The immune system then triggers on it, and because it's been damaged into a different protein structure, and that's the origin of Hashimoto's autoimmune thyroid disease.
So
The
I'm sorry to cut you off. I'll
I
start
just
waving my hand every time
Yeah,
I have a
well, I
question.
just wanted to finish one thought. We talked about how the high levels or excess levels of hydrogen peroxide are damaging. The other thing that plays an important role in damaging the thyroid is selenium deficiency, which we touched on earlier. The selenium is not only incorporated into the deiodinase, it's also incorporated into all of our major intracellular antioxidant, which is the glutathione, is a selenium containing antioxidant protein. So selenium deficiency, along with elevated TSH from iodine deficiency, causes excess hydrogen peroxide generation. It's not being neutralized by the antioxidant system because of the selenium deficiency, and that leads to either even greater damage. We use the analogy of a nuclear reactor meltdown. And that's there's actually a description by Dr. Vanderpass in 1990 of a form of thyroid meltdown similar to that in Zaire, Africa. Uh, there's a selenium deficient area, and the people are all selenium deficient. And what happens shortly after birth is they they have complete destruction of the thyroid gland from the uh, iodine deficiency, and selenium deficiency causes a high TSH, which stimulates hydrogen peroxide and damage it, destroys the entire thyroid gland. So that's called myxomatous cretinism, in complete destruction of the thyroid gland, uh, which is an extreme example of the main pathophysiology. And then the if you look at most of the pathology involving the thyroid nodules, goiter, uh, uh, thyroid cancer, um, autoimmune thyroid disease, it's all related to damage from excess hydrogen peroxide. A number of authors have made that observation. I didn't come up with that, but we put, it's all in the book. Uh, and So I'm sorry I interrupted you. You were going to
Yeah.
ask a question.
I have a few questions, but
Yeah,
first, one therapy that's showing a lot of promise for hydrogen peroxide, and I use it a lot with my clients for inflammation, is molecular hydrogen. So I don't know if you've looked into that area. It's clearly a very growing space, but
yeah.
so a few questions. First, with the selenium, are you recommending selenomethionine or specific selenium? The second thing is, it would seem that higher TSH really is an indication that the body is not only very inflamed, but the body is also stressed at the same time. And whatever that's from, the selenium deficiency, other factors, other autoimmune issues, like there's a whole host, obviously. And then is that why we see people with thyroid issues are generally higher risk for cardiovascular disease because, well, there's the TSH thyroid cholesterol connection, but also if the TSH is elevated, the inflammation is there. We know inflammation is a factor in cardiovascular disease, and stress is there, and stress is a factor. So I'm trying to connect the dots. So a couple of questions there. The selenium, methionine, the inflammation, stress, the cardiovascular connection.
Yes, yes. Selenium methionine is probably one of the more biologically active forms of selenium. I think it's an excellent way to take selenium. If you go to the vitamin store and ask for, selenium tablets, most of it's selenized yeast,
Mm.
the which is, you know, very popular and inexpensive. Uh, and The other question you had about inflammation and coronary artery disease with low thyroid condition. The big study which showed that connection and showed that Broder Barnes was right all along. Remember, Broder Barnes's book was from 1976.
Mm.
So since then, there's been a huge volume of research. The one that I quote the most is the Hunt study, which was done in Scandinavia, and they looked at roughly 10,000 women, 8,000 men. Uh, Looked at the thyroid labs and followed the patients over time, and it turned out that the patients with the TSH in the upper third of the range, meaning all within the normal range, but in the upper third, those people had a 70% greater chance of having a heart attack than the people in the lower third. So just that small difference in thyroid function could explains increased risk for heart attack. Of course, Broda Barnes wrote an entire book called Thyroid and the Riddle of Heart Attacks. Uh, and it turns out that he was right all along. Another study which showed that Broda Barnes was correct was uh, the calcium score studies. It turns out that the cholesterol panel is not very predictive of who's going to have a heart attack. However, the calcium score is highly predictive. And what is the calcium score? The calcium score is a CAT scan that takes pictures through the heart. The main interest is the amount of calcification in the coronary arteries, and they have a little computer program that can measure the calcification. It was based, and the number is given to the amount based on Agetson's work. He was a cardiologist in South Beach. He wrote this South Beach diet book, which was very popular about 20
Mhm.
years ago. And the calcium score is usually in the Agetson units from 0, and it can go very high. Calcium score of 0 is the best score, means no risk for heart attack. That means there's no calcium. If the calcium score is below 100, according to a study by Joshua Mitchell at Walter Reed, published in the American Journal of Cardiology around 2004, 2005, if the calcium score is below 100, then there's no benefit from a statin drug, regardless of whatever the cholesterol level is.
Mhm.
Above 100, he was able to show a benefit, a small benefit, and the benefit increases with the higher calcium scores. Um, and there's other research on calcium score showing that probably the most important parameter is not that single calcium score, but change in calcium score over time. If the magic number is 15% annual change. If the calcium score changes less than 15%, patient is golden, regardless of what the starting calcium score is. Very low risk for heart attack. If calcium score annual increase is greater than 15%, then that patient's at high risk for a heart attack over the next few years. That study was done by Paolo Raggi, who is at Tulane in New Orleans, and again around 2002, 2004. Those are the two main studies. There are more. Of course, there's a lot of calcium source studies done by Matthew Butoff, who's is probably the king of calcium score studies. He showed that statin drugs are not really that useful for reducing progression of calcium score. However, natural botanical aged garlic, and the one that Dr. Matthew Butoff studied was kyolic. Kyolic garlic was very effective at slowing progression of calcium score and therefore benefit for the cardiac patient. And then we came up with a whole list of supplements, for which we call the calcium score protocol. Included would be, high dose vitamin C, which was the Linus Pauling protocol. And then we also include vitamin K, which prevents soft tissue calcification. And proteolytic enzymes are very useful. A number of studies show that proteolytic enzymes such as nattokinase, lumbrokinase are very effective at helping the coronary artery disease patient. And then,
The primary mechanism of action of like the nattokinase and all these enzymes is to reduce the inflammation.
exactly. They reduce inflammation. They also, dissolve proteinaceous, excess proteinaceous debris that accumulates along the wall of the arteries. Uh, and, uh, that's a good question. Where does the inflammation come from in patients with coronary artery disease? What is the most common source? And uh, this comes from my other book, which is here someplace. Where is it? It's called. Oh, here it is. Here's the other book. So uh, this is Heart Book. I don't know if you've seen this one. Anyway,
Yeah.
everything that we've discussed in the last few minutes is in this book, Heart Book, and the talks about calcium score, etc., and the calcium score protocol. And what was your question again on
No, I
age?
was just mentioning that part of what the enzymes do is
Oh,
they.
the inflammation. Yes, the inflammation. So the the probably the and pathologists can be quoted. Most pathologists that look at calcium score and calcification in soft tissues will tell you that calcification in soft tissues, which is quite common in we see it quite commonly when we look at CAT scans of people on humans. Calcification is caused by inflammation in the wall of the artery. So the big question which you have and everybody has is what is causing that massive inflammation in the wall of the artery, which causes the coronary artery disease? And there are about 40 studies now which show using modern techniques, modern testing techniques. One is called PCR, polymerase chain reaction. Uh, uh, researchers can actually identify polymicrobial infection in the wall of the arteries. There's plenty of atherosclerotic samples. The surgeons are removing it and putting it in little jars, and they store it up in the hospital pathology departments. So there's lots of samples to test, and there are about 40 studies now. Sure enough, it's polymicrobial infection, and they actually know the exact species. They know where the organisms are coming from, and one source is dental
Mhm.
organisms, and the other one, of course, is gut organisms. So, gut organisms getting into the coronary arteries. How does that happen? It's the most likely explanation is this thing called leaky gut. Leaky gut. What causes leaky gut? Probably the most common cause is wheat gluten sensitivity. Um, uh, and that was initially described by Dr. Fasano, who at the time was a pediatric endocrinologist at I think Johns Hopkins, or maybe it was University of Pennsylvania, one of those two. And he did all he had a team of PhD students working in the laboratory, and they came up with a number of striking discoveries, one of which is they discovered zonulin, which maintains the tight junctions in the in the wall of the epithelium of the GI tract. And there are certain people, it can be genetic. So some people are sensitive to wheat, and they have excess zonulin production, which keeps the tight junctions open. When the tight junctions are open, you have leakage of contents into the bloodstream. What are those contents? The friendly bacteria, the gram-negative bacteria that's in the gut, in the bowel, will leak into the bloodstream. Some of it is live bacteria that circulates through the bloodstream. That's called low-level endotoxemia.
Mhm.
And the white cells try to gobble it up. And those same white cells are called macrophages. They have been found inside the atherosclerotic plaque containing the organisms, the microorganisms. When you look at it, under the microscope and do special stains. So that's probably one of the mechanisms of how the infection travels to the wall of the artery, is the macrophages gobble up the gram-negative organisms and then migrate into the wall of the artery. And then, the microorganisms then set up house, and it creates what's called a biofilm, which is a colony of living microorganisms, and that will incite an inflammatory reaction,
Mhm.
which then the body responds to massive inflammation in the wall of the artery with soft tissue calcification. That's what we measure on the calcium score.
Mhm.
So the calcium score is giving a very important information about what is happening directly in the wall of the artery, and that's why it's much more accurate and sensitive than the cholesterol level, which is measuring cholesterol in the blood, which is distant from the wall of the artery.
Mhm.
And you know, this sometimes comes up in conversation. I remember I was talking to a lady pharmacist about this, who was saying, "No, no, no, it's not the calcium in the artery. It's the cholesterol. That's."
Oh,
And I tried to explain to her, no, it was really the calcium, not the cholesterol. But
she was
it's
still in the old frame of mind.
yeah, it's commonly believed that cholesterol is the culprit in coronary artery disease, but we show in the book that the whole cholesterol theory has been overturned by new technology, and the new technology is the calcium score.
Yeah, I think it's slowly changing. The whole cholesterol theory is null and void now. Even dietary cholesterol doesn't have much of an impact on cholesterol, but that's not including if you eat Wendy's and junk food all day. That's a different conversation.
Yeah, the junk food,
But
right,
if
right.
you, so just bringing this back, if in the context of cardiovascular disease, we can say, and a lot of practitioners, and Broda Barnes included, and Dr. Ray Pete, and a lot of doctors will say, yeah, thyroid is really the root cause for a lot of this. And for those of us who have read Dr. Broda Barnes' book, it it kind of alludes to, well, every health issue out there, because he just breaks it up by condition. You're like,
Yes,
well,
yes,
is this pretty much is telling me that thyroid is the root cause of every issue. He mentions respiratory illness, TB, cancer, the celiac aspect, like everything. So then in what you're saying with the macrophages, Dr. Barnes tells us that people with low thyroid function have thymus issues, so therefore they're not creating enough white blood cells. Then they don't have a strong immunity, and like it all connects with slower bowel transit time. Now you've got more inflammation in the gut. Now you're releasing more endotoxins, and really what is, I'm hoping it's telling people, well, it's at least telling me that when we're addressing optimizing health, thyroid should be right up there.
yes. Of course, the what you're referring to is in Broda Barnes devoted a whole chapter to thyroid and the immune system. And one of the things that he said was the thyroid function is responsible for proper functioning of the immune system. Low thyroid condition means poor immunity, poor defense against infection, whether it's viruses or bacterial infection. Also, poor defense against cancer, because our immune system does cancer surveillance. And so, um, you know, and I devoted an entire chapter to the new research, after between 1980 and 2020, over 40 years, there's new research showing, you know what, Broda-Barnes was right all along with the connection between low thyroid and immune dysfunction.
Hmm.
And the a lot of the studies are done in animals, in mice, for example. You can uh, there's a cancer model in mice called the stress-induced uh, rapid progression of lymphoma. They inject the mice with lymphoma cells, and then they give the mice stress by immersing them into cold water. But not only are they in cold water, but they're in a plastic tube, so they're restrained. It's called restraint stress. They're in a plastic tube, so only their nose is sticking up above the water. That's very stressful for any animal. And what they find is rapid progression of lymphoma compared to controls that are not stressed. Uh, and when they give the restraint stressed mice T3, that reverses everything, and the progression of lymphoma is reversed. And there are other studies where they give the mice injections of endotoxin, which is probably the most toxic bacterial substance known to mankind. And virtually all the mice die within a short period of time. They inject the mice with the thyroid hormone, and there's a tremendous improvement. Only 30% die.
So that begs the question then, why are we not more proactive in treating cancer with thyroid therapy?
Uh, that's a good question, and we cover that. The research on it is sort of ambiguous. The It turns out that some cancers have thyroid receptors, and the thyroid will actually stimulate growth. Cancers make their own growth factors, and they will hijack cells in the environment to manufacture growth factors for them to make them grow, and proliferate. Uh, the so the Another thing is that I discovered writing the book is that cancers make an embryonic form of deiodinase type 3, which converts T4 to reverse T3, which is the inactive form. So, uh, no, it's cancer and thyroid is complicated,
Mm.
and it we may eventually get to the point where we we can figure out how to use thyroid properly in cancer patients, but uh, we're not quite there yet. And so, endocrinologists and oncologists pretty much stay away from thyroid, unless in cancer patients, unless the patients are has an obvious need for it.
Hmm.
Uh, and But yeah, there is a connection. I think you're absolutely correct. The other connection is selenium. We talked about selenium being important for antioxidant glutathione production. Selenium is also key to a whole family of selenoproteins that are involved in cancer surveillance. Uh, so low selenium is associated with increased risk for cancer because the cancer surveillance system's not working. Uh, and that study was done by the University of Nebraska by Dr. Combs. It's called the NPC trial, which showed, and they recruited skin cancer patients from clinics in the Southeast United States. Average selenium was about 110. Remember, our cutoff is 135.
Mm.
So, 110 is considered pretty low. And they It was a randomized control trial. They divided the patients into two groups randomly. Uh, Half the patients received selenium supplements, the other half placebo, and they had a dramatic reduction in all cancers in the selenium treated group.
Mm.
And there are other studies. So, the cancer the cancer book. I actually have another book on cancer.
Mhm.
I don't know if you've seen it.
Yep, I have. I've seen them all.
Yeah, and Cracking Cancer Toolkit. This was the cancer book. We talk about cancer surveillance, things like that. The cancer book was on Amazon for 5 years, and it was in the top 30 of books in the oncology category for 5 years. We had about 100 reviews, average 4.8 stars, and after 5 years, they blocked the book. They took the book off
You want the
and told
truth getting out.
they told me I got an email. They said your book is being blocked because of offensive content. So yeah, offensive to who? To the chemotherapy industry, obviously. But anyway,
Yeah, because you're stealing their money.
uh, a lot of this stuff is financial. I think 90% of it is financial. But what's happening? The book, the Cracking Cancer Toolkit book came out 5 years ago. And over the last 5 years, we've seen a tremendous increase in interest in repurposed drugs. A lot of the antiparasitic drugs have
Mhm.
excellent anti-cancer activity, and we see you know a, a, a new trend, which is we have very high-level physicians who have been kicked out of institutional medicine because for example Pierre Corey, Paul Merrick, Peter McCullough, those people were highly published academic physicians in running intensive care units, things like that, and they were kicked out for using ivermectin in their COVID patients.
Yeah.
And so they, what are they doing now? They're looking at things like using antiparasitic drugs, repurposing those for anti-cancer treatment.
Yeah.
So I wrote the book in 2020 before all this happened. So, and it turns out that the you know the use of repurposed drugs is, I think, going to be bigger and bigger, and eventually it'll be a tidal wave, which uh, which will change how oncology is practiced.
It was
Uh,
just after that time frame where you released your book, of course, that ivermectin started getting a lot of notoriety again through Joe
exactly.
Rogan using it for COVID, and you're like, I was there first.
Yeah. It's
What it,
uh, it's not just ivermectin. There's a whole list of antiparasitic drugs that have anti-cancer activity. Uh, you know, the first line treatment for malaria is a drug called artesunate, or another name for it is artemisinin. Artemisinin you can buy at the vitamin store. It's an herbal preparation. The artesunate is the drug version, and that was developed by a Chinese doctor uh, by the name of Tu Youyou. She received the Nobel Prize in Medicine, and along with ivermectin, the two ivermectin doctors, the Japanese and American, one Japanese, one American, received Nobel Prize. All three of them are the same. The same. They shared Nobel Prize. I think it was around 2007, something like that. And the she, the Chinese government at the time, they were fighting the war in Vietnam, and way back then, and the Vietnamese North Vietnamese soldiers were dying of malaria. So the Chinese government uh, asked her to come up with a good treatment for malaria. So she came up with the artemisinin, which is an anti-malarial drug. Uh, the molecular biology is all worked out, and it turns out that it's also an excellent anti-cancer drug. Uh, and so there are others. There are other antiparasitics. The hydroxychloroquine, was a big. A lot of these drugs are also antiviral. and so hydroxychloroquine uh, was also part of the antiviral armamentarium. That's an originally anti-malarial,
Mm.
along with mefloquine and chloroquine, hydroxychloroquine, this sort of family of drugs. The mefloquine is probably the most effective of the three in terms of an anti-cancer drug. However, the problem is it's also the most toxic. So we have to we have to look at toxicity with these things. And
We got to weigh up the
the
pros and the cons.
the mefloquine is associated with neuropsychiatric problems, and so we try to avoid that. Although some of these researchers have made the point that, you know what, if a patient is you know end stage cancer, it's probably worth the chance to just go ahead and use the mefloquine. But so the book is no longer on Amazon, but we have a new printer. It's the Lulu printer, Lulu, which you can purchase from lulu.com.
Okay.
You just put in the title on the search bar, it pops up. There are also links to the book on Lulu
Mm.
from my website, which is jeffrey-md.com. You just go to the books, the menu selection for books, and then go down to the book, and there's a link to both the ebook and the print version. Uh, so we moved it over, and so it's still available. And so that's it's amazing how we've made so much progress in thyroid, in repurposed drugs for cancer, heart disease, and then of course we haven't really touched on the hormone replacement. We briefly mentioned the
That's
2002.
probably a conversation for another day because that is
Yeah.
big in itself. But the
Yes.
cancer is right up there in like the top kind of 3 to 5 disease outcomes that worry most people. We've got the cancer, the cardiovascular disease, and some sort of dementia is right up there. And then
Yeah.
any paralytic diseases, arthritis, loss of leg function, like these are where people are really concerned about their health. And um, your book is invaluable for anyone, I think, that is dealing with cancer for sure, which is unfortunately a lot of people. So, Dr. Dash, if you don't mind, could we circle back to the TSH? Because I can hear voices saying, ask him about what his ideal TSH number or level that you're looking for is, but also, are you concerned about TSH suppression with natural thyroid treatment? A few of our colleagues have mentioned in their conversations that they're looking for TSH to be below 1, and one more recently had mentioned, look, if it's closer to 0, I'm happy with that, provided all the other markers, the symptom picture and all is good too.
Yes, the TSH the question of TSH suppression is a big issue in endocrinology, and so we have an entire chapter devoted to TSH suppression benefits and adverse side effects. The It turns out that mainstream medicine, if you go to, for example, I remember a lecture I went to, medical lecture, where the speaker was telling the audience, which is all doctors, never ever suppress the TSH. It's not allowed.
Mm.
Never do that. And why not? Well, because there are adverse side effects. Number one, causes osteoporosis, and the so what is that really true?
Yeah.
We know that in Graves' disease, thyroid hormone levels are very high, and that will be associated with loss of calcium from the bones and eventual osteoporosis. However, TSH suppression from thyroid medicine, as long as the thyroid hormone levels, T3 and T4, are in the normal range,
Mm.
the patient is not hyperthyroid, and studies have been done showing no, there's no osteoporosis in those TSH suppression uh, without increase in thyroid hormone levels. So the The other thing to think about is mainstream endocrinologists will suppress the TSH very commonly in a patient group that has had thyroidectomies for thyroid cancer, and this is a very large population of people now. They will suppress TSH below the reference range, and it's thought to as a treatment to prevent recurrence of cancer. So we have a huge population of those people with suppressed TSH. They give them thyroid medication to suppress the TSH. Mostly, endocrinologists will use levothyroxine. But yeah, the TSH is suppressed below the reference range. And that population has been studied. There are numerous publications studying that population. And there are no adverse side effects. There's no reduction. There's no problem with bone density. Uh, there are no other adverse side effects. Uh,
They're not
Now,
hyper, because that's what a lot of people are being told. Oh, if it's too low, you will be hyper, you'll have heart palpitations, anxiety, extreme weight loss, which a lot of people would welcome. But that's what
no,
they're being
no.
told.
No, no, the thyroid hormone levels are maintained in the normal range. So, but by no stretch of the imagination can these people be hyperthyroid. They're asymptomatic. They have no, there is, this thing called hormone excess, thyroid medication excess. Say my dosage is up 2 pills a day, and I say to myself, you know what? I feel so good with 2 pills a day. I'm going to take 10 pills a day. I'll feel 5 times better.
Yeah.
And some people, believe it or not, some people think that. And thank goodness, our patients, we actually go over this over and over again with them and educate them. So you know what? Don't do that. It's not a good idea. And what the main symptom we're looking for with thyroid excess is the rapid heart rate. As
Mhm.
you mentioned, the palpitations, rapid heart rate. Why is that? It's because thyroid activates the nervous system, and the little pulses that go to the heart that trigger the cardiac contraction. It's called the QRS complex on the EKG. That's an electrical pulse in the nervous system that goes to the heart, and so thyroid activates the entire nervous system. The cardiac pulses go faster, faster. So, patient's not going to miss that. It's going to be obvious.
Yeah.
And They are educated. We go over this. We have little information sheets on them. We go over it sort of ad nauseum. So, they are completely knowledgeable and trained that if that happens, what do you do? Take a break from your thyroid pill that morning. Take a vacation, a break from your thyroid pill. Symptoms go away fairly quickly after about 6 hours.
Mhm.
And so I stated in the book, that in my opinion, natural desiccated thyroid is safer than T4 because symptoms of thyroid excess dissipate within 6 hours because of the shorter half-life of T3, which has a 24-hour half-life compared to T4, which is a 1 week half-life.
Mhm.
So the natural thyroid is more forgiving, and the patient can take a break, and then the next day when they're feeling back to normal, they can resume the thyroid medication at a lower dosage. We usually go by 30 milligram increments. For natural desiccated thyroid is 1 grain is 60, 30 milligrams is a half grain.
Mhm.
And The TSH suppression, so in some patients, they need enough dosage to have complete relief of low thyroid symptoms.
Mhm.
And in some patients, the TSH will be suppressed below the reference range, and that's perfectly okay. Uh, for natural desiccated thyroid, remember the pituitary, which makes the TSH, is a little more sensitive to the T3 in natural thyroid. So, that immediately re- tells the pituitary to inhibit production of TSH. So I think it's more so than T4 only medication. The problem with T4 only medication is uh, the the pituitary is more sensitive, and it will convert the T4 to the active form T3 in the pituitary,
Mhm.
which then suppresses TSH. However, in the periphery, which means the rest of the body, the musculoskeletal system, the rest of the body, the T4 is recognized by the iodine system as thyroid excess. And so to protect the cells, the iodine system will preferentially convert the T4 to reverse T3, which is the inactive form, as a protective mechanism. So the cellular deiodinase system sees the T4 medication as hyperthyroidism. You're getting this huge bolus of T4, and the periphery in the brain, it suppresses the TSH, so you have this low TSH. But in the periphery, there's inhibition of conversion of T4 to T3, the active form. So the patient remains hypothyroid. The
That's
patient
why they
remains
still have cold hands, feet,
exactly,
nose, because you might be getting a
exactly.
tiny bit of relief, tiny from the periphery, or the pituitary, which is what I mentioned earlier. I see my clients, they might get a small boost of energy. They feel a bit better, but they still have all of the
Yeah.
other symptoms.
And then and the solution is a combination T3, T4, which will then the patient solve the whole problem. The patient will then feel better and have normal, good thyroid function in the intercellular periphery. The all that research was done by Antonio Bianco's lab, mostly working with mice, and uh, these are the types of patients that we see. Their labs will typically show the free T4, all the labs will be in the normal range, but the free T4 higher than usual, the free T3 lower than usual, and the reverse T3 higher than we usually see in the upper end of the range.
Yeah.
And those people come in with typical symptoms on the levothyroxine. The remember those little Chinese bamboo finger
Yeah.
traps that the more you pull them apart,
The
the
tighter they got.
the
Yeah.
tighter it gets. That and we use that analogy because the patient goes into the endocrinologist and they're on 100 micrograms of levothyroxine and they're miserable. They still have low thyroid conditions. So the endocrinologist, oh, no problem, we'll just increase it to 125 micrograms. Well,
Mhm.
it's the Chinese finger trap trick. The more you levo, the more the periphery recognizes it as thyroid excess. It just makes it
It's
worse.
worse. Yeah.
Yeah, so that we use the Chinese finger trap.
Lord.
So this real solution is combination therapy.
So what are you testing? So you are testing TSH, free T4, free T3, reverse T3. Are you also looking at other tests like the antibodies, but
Yes,
do
yes, of
you
course.
also look at ferritin and cholesterol, the liver enzymes?
We have a fairly large, fairly lengthy routine panel, and we'll look at in terms of thyroid patients, we look at the thyroid antibodies routinely on everyone, the TPO and thyroglobulin, that's routine for everyone. We also look at selenium. We talked about that earlier. That's routine. We also check serum B12, folate. Uh, we check anti-gliadin antibodies. Many of these people are wheat sensitive, and the anti-gliadin antibody test is useful. If it's positive, it's useful. If it's negative, it's not very sensitive. So we go on for further testing. The stool test for the anti-gliadin antibody is probably the most accurate. So we do go on to that test. Uh, in the end, virtually all of our autoimmune Hashimoto's patients will eventually be on a gluten-free diet, and most of them will feel so much better.
Mhm.
Um, we also test, for the iron and ferritin routinely in everyone. People with gastrointestinal malabsorption you typically see a pattern of borderline low B12, borderline low iron and ferritin. They're having trouble absorbing. They have malabsorption for calcium, iron, and
Myself and Carol mentioned that on our call. We had a discussion around the low B12 not being so relevant as a marker for your B12, but an indication of inflammation in the gut and low good bacteria, which then
yes,
I would propose would give us an idea. Well, if the B12 is low, we can guesstimate that the inflammation is high. Therefore, potentially the endotoxins are also high.
yes, yes. The B12 is if you see low B12, low selenium, low iron or ferritin. It's a typical pattern. It suggests malabsorption, and most common cause being wheat gluten sensitivity. So we will usually make sure that we go to the stool test for the anti-gliadin antibody, which is more accurate. Uh, and the other marker that was mentioned by Jonathan Wright, the pioneer in holistic medicine, uh, in terms of malabsorption, is the low triglyceride level. And there is a test called the triglyceride loading test, mostly used in children. They do a blood triglyceride level, then give a little drink of triglyceride. It looks like cooking oil, and they drink that down, and then they, a half an hour later, draw another blood level to see that it should end up in the blood if it's being absorbed. So that's a very good test for malabsorption. Stool tests. There's a test for fecal fat in the stool, and inability that's malabsorption because the fat is not being absorbed. So there are other indirect ways to look at it, get little markers that, and the most common cause is going to be the wheat gluten sensitivity. Many of these patients have had this going on for many years, and they've had leaky gut for many years, and so they've ended up with other food sensitivities. The undigested food particles end up in the blood circulation, and the immune system will trigger an immune response to those food particles. So, the way it usually works is if the patient is eating a certain food, it's their favorite food. It's all their favorite foods that they eat the most that will show up on the testing.
If
Uh,
it's your favorite food, it's
yeah,
probably bad
you've
for you.
you've seen that. And some patients know that they'll eat their favorite food for 2 or 3 months, and then it makes them sick, and then they have to switch to a whole new panel of favorite foods. And we've had patients that know that, and they just will switch every 3 months. Uh,
So what
but
about then high triglycerides? Because we see that more common or more often than not is the higher triglycerides.
Yeah, the triglyceride are usually dietary. High sugar, high carbohydrate diet. You'll see usually be the culprit. And just by modifying the diet, we'll see that normalize. In terms of diet, the diet coronary artery disease connection. People ask, well, what is the best diet to reverse coronary artery disease? And it's actually the plant-based diet is the only diet that has been shown in the medical literature to prevent and actually reverse coronary artery disease. Dr. Estelin was a big proponent of plant-based diet. I used to go to the medical meetings years ago, and they'd always have a plant-based diet cardiologist, and he would say, plant-based diet, this is what you have to do. And, you know, the doctor sitting next to me would say, "Oh no, not this again. None of my patients are willing to do that. Nobody, they love their meat. They have to eat meat. Nobody can do the plant-based diet."
Well,
And
part of it is the fiber. So if you can increase your fiber, and then the other part is the polyphenols and their antioxidant capacity too. So
yes, yes, and the you know what is the exact mechanism of the plant-based diet having so much success in reversing coronary artery disease? I don't think we really know. There's some speculation, um, and you know, it, what happened was I kept going to meetings, and they eventually wore me down. And so after the third or fourth meeting, the plant-based diet, they wore me down. I said, okay, let me take a look in the medical literature, and maybe there's something to this. So
mm,
uh, I took a look, and you know what? You find in the cardiology literature, the American Journal of Cardiology, case reports, the typical case report, a 70-year-old male has chest pain, goes into the hospital, they do a cardiac cath, he has triple vessel coronary artery disease, and they tell him he needs a cardiac bypass. He says, nothing doing. He goes back home, goes on a plant-based diet.
mhm.
His chest pain goes away. He comes back, and they recheck everything is all, and it's not back to complete normal, but it's definitely improved, and his chest pain is gone.
Yeah.
Those are typical case reports in the cardiology literature.
Yeah.
So there is something to it.
Yeah.
Part of it is, they've done animal studies showing you can simulate leaky gut and accelerate coronary artery disease just by feeding animal fat to animals. The animal fat causes leaky gut. Anything that makes leaky gut will increase progression of
You
coronary
know,
artery disease and
I have a
calcification.
I have a theory there on the animal fat, and
Yeah,
maybe you can give me a bit of insight on this. It's something I speak about a lot lately that nobody likes to hear because everybody's on this like not the whole food kick, but the saturated fat, the tallow skincare, using tallow for cooking, using all the parts
yeah,
of the animal. And my argument is I don't think that's such a good idea because where do mammals store the majority of their toxins, heavy metals, inflammatory molecules, hormones? Well, it's in
hmm
the fat. And if
yeah,
you're consuming a lot of that or even putting it on your skin, I would argue would probably age you faster because of its oxidative capacity. But if you're consuming a lot of this animal fat, bacon fat, even beef fat, and I really, again, my argument is I don't really care if it's a grass-fed animal living on the top of a mountain in New Zealand somewhere. This crap is falling from the sky, so you will never get completely clean animal fat. And if you're
yeah,
consuming that and you already have maybe some things in your diet that need to be fixed, you've some stress in your life, whatever, now consuming these so-called animal fats, and we see a big movement with the keto diet and the carnivores as well, and now you're putting it on your skin too.
yeah.
All of that has to pass through the digestive system, which we could argue you're pretty much consuming just pure toxins bound in fat, which helps them pass into the intestinal tract a lot easier, that kind of liposomal aspect of things. And that's making things even worse.
That's a good point. We're living in a toxic soup. They spray glyphosate over all the wheat fields as a drying agent. Wheat is not genetically modified. It was modified using hybridization techniques into this semi dwarf, shorter stalk wheat, but increased the working the kernel version of at the end of the wheat by a factor of 10. That
Yeah.
was done by Norman Borlaug, and that was he received the Congressional Medal of Honor back in the 1980s, and he and that the new wheat prevented starvation in countries like Bangladesh. Instead of starving, they now had a food surplus. But what they're doing is they spray glyphosate, which is Roundup, onto wheat fields, not as a weed killer, but just to kill, just as a drying agent. It dries up the wheat so they can harvest it easier. And so, wheat products are loaded with glyphosate, which is carcinogenic. It's highly toxic. Stephanie Seneff has studied and written about glyphosate, uh, along with Susan Swanson. There's a nice series of articles. They've correlated glyphosate usage in the United States with 22 diseases, including renal failure, uh, gastrointestinal diseases. And what happens is the glycine in glyphosate is it's not normal glycine. It's glycine with a phosphate attached to it.
Mhm.
So when that modified glycine uh, is incorporated into proteins, it throws the conformation of the protein into total chaotic disarray, and that wreaks havoc with all of the metabolic activities in the body.
Mm.
It's also carcinogenic. So the glyphosate in the wheat is a huge problem. The genetically modified food is a huge problem. Uh, the when I was a kid, I remember, this was back 1950s. People used to go and fish in Lake Michigan. We lived
Mhm.
in Chicago. And you could eat the fish. And then shortly after that, 10, 15, 20 years later, guess what? Lake Michigan is contaminated with mercury. And that's not just Lake Michigan. It's all of the streams in the United States, all of the rivers and streams are contaminated with mercury.
Mm.
We've totally contaminated the entire country. You cannot eat the fish. And it's not just, there's more. I mean, there's other chemicals that are being dumped into the environment. Uh, it's just endless. And if you take a look at, well, what are the most common carcinogenic chemicals in the environment? There are hundreds of,
Yeah.
when they look at newborns, they can analyze the umbilical cord blood. They find hundreds of chemical contaminants in umbilical cord blood on newborns,
Mhm.
and it's crazy. But yeah, that's something that we try to ignore. It's most people try to ignore it, um, but it's certainly not good for the population. That's for sure.
Yeah. It's it's one of those things that's gotten so out of control that it seems like there's no hope. We could never undo it. But on a personal level, we can at least stack conditions in our favor. And Dr. Brownstein and I discussed iodine therapy as well for displacement of a lot of these heavy metals, specifically
Yeah,
bromine, but also potentially fluoride, chloride.
yeah,
But we've covered a lot here, a lot so far. Let's just kind of leave people on a bit of a high note. Um, we mentioned selenium,
yeah.
selenomethionine. I mentioned molecular hydrogen. We've kind of touched on the
Well,
nutrients.
one point I wanted to add about the hydrogen, molecular hydrogen. There's some nice case reports on PET scans, CAT scans showing metastatic disease in the brain, which lights up like little light bulbs on a PET scan or on a CAT scan with IV contrast, before and after inhalation of hydrogen gas, molecular hydrogen gas, and dramatic resolution of intracranial, metastatic disease involving the brain in these case reports. So, I was very impressed with that. And the mechanism, it's anti-inflammatory. It's an antioxidant. It's an anti-inflammatory. It's I don't think they've actually figured out the exact mechanism of how it works, but it's very dramatic. And
Well,
it's
it
easy. Yeah, hydrogen gas is available. You can order it. They deliver it to the house. And but it's not widely known. It's not widely used.
it's getting there. There's momentum for sure. And speaking of your heart book, molecular hydrogen is first line of therapy in a lot of Japanese hospitals for people who have had stroke or experiencing ischemia. And I had Dr. Tyler LeBaron, who I'm sure you've heard of. He's from down your way. He's one of the
Yeah,
leading researchers on molecular hydrogen in the world. He founded the Molecular Hydrogen Institute, and he was on my podcast a couple of months ago, and he was mentioning like molecular hydrogen shows promise for reversing fatty liver and improving all metabolic markers, which I think it's all, as we spoke about, connected to thyroid. I think ther
yeah,
molecular hydrogen is valid therapy for supporting thyroid health,
yeah,
although a little bit pricey right now, which is
yeah.
challenging for people. But what
Well,
other
yeah. Go ahead.
I was just going to say, what other supplements or nutrients would we recommend? What about vitamin D? What about magnesium, berberine, anything
Yes.
else?
Well, we do. We test. Thank you for mentioning that. Our routine panel includes vitamin D for everyone. We want to optimize vitamin D. And I was first introduced to the importance of vitamin D. I attended the one of the orthomolecular medicine meetings in Canada when Abram Hoffer was still alive. This was his 90th gala birthday celebration.
Oh, cool.
And then the meeting was the next day. I was sitting there. So the meeting the next day, I was in the conference hall, sitting next to a Canadian nurse who confided in me, with no um, no stimulus from me. She confided in me that Abram Hoffer healed her uh, son's multiple sclerosis with high dose vitamin D.
Mm.
And so I thought, maybe there's something to that. So I went home and researched it. So yeah, vitamin D. Grant, Dr. Grant is probably the greatest vitamin D researcher. Uh, low vitamin D is associated with increased risk for all cancers. And in terms of vitamin D and the immune system, there's an important link. Higher vitamin D gives us improvement in the immune function. And the most remarkable study was done by Dr. Borscht, uh, who is almost like borscht but without the T. And he studied COVID patients in the hospital and found that if the vitamin D level is above 50, range being roughly 30 to 100, if the vitamin D level is above 50, mortality from COVID infection in the hospital was reduced to zero mortality. So we use 50 as our cutoff for vitamin D. You want to be above 50 based on that study. And it's also true for, other viral infections. Lots of studies in children, vitamin D level is important for uh, prompt recovery from other viruses, flu viruses, et cetera. And also, Dr. Grant points out that vitamin D is also inversely proportional to cancer risk. So low vitamin D increases risk for all cancers. Um, the We also test for RBC magnesium routinely for everybody. You want good magnesium levels. Magnesium is important as part of our antioxidant protection. And What was the other one
I had
that you mentioned?
mentioned berberine or anything that helps
Berberine. Yeah,
control blood
the
sugars.
the berberine is very important. And one of our newsletters talks about berberine as antidote to our modern epidemic of leaky gut.
Love
And
berberine.
yeah, berberine is great because remember we talked about um, Dr. Fasano and the zonulin opening up the tight junctions. Well, berberine has been used for centuries. It's an old folk remedy for the treatment for diarrhea, which is caused by opening up the tight junctions. Berberine will keep the tight junctions closed, so it's really great for preventing leaky gut. So we use it routinely in our calcium score protocol to prevent further leakage of low-level endotoxemia. And As you mentioned, it's also great for blood sugar control. It's sort of a botanical version of metformin, which is first-line drug treatment for diabetics. And I think, by the way, I think metformin actually a good diabetic drug. Uh, it's maybe because it's a derivative from a botanical, the French lilac plant
Mhm.
is where metformin comes from. And the berberine also has anti-cancer activity,
Mhm.
which numerous studies on that. So the uh, we use berberine a lot. I think it's a great it's a great addition to the most any health program.
I have another theory that you might be interested to hear. So I mentioned my
Yeah,
tallow theory and a few others. You mentioned endotoxin control there with the berberine. Most people don't know that berberine is a powerful antimicrobial. And I don't know if you've came
yeah.
across people taking berberine and they immediately feel nauseous, like really sick, and they can get diarrhea. Now it's not so common, but I've seen it happen in my practice a few times. And my theory is And it would make sense to me because obviously I know these people and I know their history and their conditions, that because berberine is so powerful, when these people consume it, their bodies are very, very toxic, like extremely toxic, and
Yeah,
they are pretty much dominant in, as we'll put it, basically bad bacteria. And when they take berberine, they get a huge die-off reaction, which
yeah.
immediately causes the nausea and the diarrhea. Now, I would say that's a good thing. Push through if you can, but it can be very uncomfortable. So people don't want to push through. But I really associate that with your gut is so toxic that this is a big
Hmm.
die-off reaction.
I think that's true. And there are numerous studies showing that the the berberine is very beneficial for the gut dysbiosis. The pathogenic bacteria will be reduced, and the friendly lactobacillus and bifidobacteria will be increased in people taking berberine. So that's all very beneficial. And yeah, and you see that type of reaction with other types of treatments as well. It's a like Herxheimer type reaction
Mhm.
where there's a sudden increase in toxicity related to the treatment. You see that with, for example, antiparasitic treatments in patients that where there's a sudden die-off of parasitic disease. Cancer, patients getting chemotherapy. There's huge toxicity associated with sudden die-off of cancer cells because the cancer cells literally burst the cell membranes and release all this, toxic intracellular material. It incites a tremendous inflammatory reaction, which is one of the explanations for triggering the cancer stem cells to grow aggressively and cause cancer recurrence after chemotherapy.
Mhm. Okay, well, berberine again may be beneficial for cancer.
Yeah, berberine has been studied as it has very good anti-cancer activity. We do talk about it in the Cracking Cancer Toolkit book.
Mhm.
Uh, there's a chapter on that includes discussion of berberine.
Last one, because I heard you discuss this with Carol last week, and I had not heard this before. So if you just kind of repeat yourself, if you don't mind.
No problem.
Ioinositol, I've used it to help with PCOS and insulin resistance and blood sugar, but you
Yes,
have specifically mentioned it can be beneficial for improving thyroid function. How so?
yes. Uh, Well, the inositol is a messenger involved in signaling. So it helps, for example, with ovulation because it's involved in FSH, follicle stimulating hormone signaling. Uh, in terms of thyroid, if you look at the production of thyroid hormone and the cascade signaling cascade of TSH. TSH hits the receptor, and then there's two separate signaling cascades. One uses cyclic AMP, and that stimulates growth
Mm,
and thyroid hormone production. The other one, cascade, uses an acetol, and that is involved in hydrogen peroxide production.
mm,
So it turns out that in when high TSH will stimulate both cascades. In Graves' disease, where the TSH receptor is stimulated by the antibodies, the TRAB and the TSI antibodies, the Graves' disease antibodies, it's only the cyclic AMP cascade that's stimulated for growth. The hydrogen peroxide is not stimulated at all. So that's why the Graves' disease patient's thyroid will be enlarged, it's smoothly enlarged without nodularity. Uh, that's because the hydrogen peroxide is the cascade that makes the nodules. But so there's no increase in hydrogen peroxide in those patients. If there was, it'd be a terrible disease. But
yeah.
so, the inositol is involved in the production of hydrogen peroxide in and it's been studied in, for example, thyroid nodules, and it's helpful in reducing thyroid nodule size. It's also helpful in autoimmune Hashimoto's patients. There are a number of studies showing um, improvement in organification, which uses the hydrogen peroxide. That's the problem in autoimmune thyroid disease is they have an organification defect. They
Mm.
have trouble attaching the iodine to the thyroglobulin, and that's because they have the antibodies to TPO. The TPO is not functioning well. The inositol will help uh, bring down the TSH and normalize all of the thyroid markers.
Yeah.
Uh, and So both for autoimmune thyroid disease and for thyroid nodules, myo-inositol is very useful. Uh, and and as you mentioned, it's also signaling uh, for the insulin pathways for the diabetic. It's all in PCOS patients. It helps signal FSH and ovulate. It gets them to ovulate. So myo-inositol is available over the counter. You can buy it on Amazon. It's
Mhm.
very popular,
Yeah.
especially for women who want fertility. That's very popular now.
Yeah. Well, Dr. Dash, this has been a riveting conversation, jam-packed with loads of information. We could go for a lot longer, but I have stuff to do.
Okay, Charmaine, thank you so much. It's been a pleasure, and thank you so much for inviting me. It's always an honor and a pleasure to do a podcast with the rest of the health community
The rest of the
and
gang.
the rest of the gang. And thank you so much again, and thank you for everything you do. And we'll happy to do it again the next time. Just let me know.
Yeah, hormones the next time. I'll set aside 2 hours. I'll put the links to your website, the books in Canada, all in the description. Thank you, Dr. Dash. This has just been a lot. It's been a lot of information. So, um, it's been wonderful to chat to you again. Thank you to Carol for connecting us. She's a
Yes,
gem too.
Carol's amazing. It's yeah. Thank you, Carol.
Yes. Well, I'll chat to you soon, Dr. Dash. You have a great day in lovely, warm, sunny Miami while the rest of us are freezing.
Yeah, thank you very much.
Bye.
Enjoy. Bye bye.